Cold plunges. There's a lot of noise around this topic, influencers over promising benefits, skeptics dismissing it entirely. But when you actually go through the peer-reviewed research, the picture that emerges is genuinely impressive. Cold exposure is a physiological intervention with documented effects on your metabolism, your brain chemistry, your immune system, and your cells, backed by scientific mechanisms we can trace at a molecular level. There's one important timing consideration that almost nobody talks about, and if you're training, you're really going to want to know it. But the overall evidence? It's stronger than most people realize. I'm Dr. Cal, a medical doctor with 7 years of clinical experience in the NHS, and I research the science of longevity to help you live longer and healthier. As a doctor, this is a topic I find particularly fascinating. The physiology behind cold exposure is well studied, and the mechanisms are now more interesting than the headlines suggest. For this video, I've gone through 23 peer-reviewed studies on cold exposure and pulled together the most important findings. I've linked every single one of these studies into a citation library that's in the description below, so you can go through and check out the research for yourself. And in today's video, I'm going to walk you through 4 key benefits from the research: neurochemistry, brown fat activation, immune function, and cellular adaptation. Then, one important timing consideration that you need to get right, especially if you're training, plus, as always, the practical protocol that ties it all together. Now, before we get on to the evidence, it's really worth understanding what actually happens when you hit cold water or are exposed to cold environments, because the physiology here drives everything that follows. The moment cold water touches your skin, specialized thermoreceptors detect the rapid temperature change and send signals to your central nervous system. What follows is called the cold shock response. This includes gasping, rapid uncontrolled breathing, and peripheral vasoconstriction, which is when your blood vessels constrict to redirect blood away from your limbs and towards your core to keep you warm. This initial phase lasts about 1 to 5 minutes, and it's the part you need to carefully manage, especially when you're first starting out. We'll cover some safety later. But here's the key distinction that underpins everything we're about to discuss. There are 2 kinds of stress. There's chronic stress, sustained cortisol elevation, inflammation, and pituitary axis activation. That's the kind that ages you. And then you have something called hormetic stress, a brief challenge followed by recovery, which leads to adaptation. That's the kind that makes you more resilient. Exercise is a hormetic stress. Fasting is a hormetic stress. Sauna is a hormetic stress. And cold exposure fits firmly into this same category. And a 2020 study confirmed this directly. Cold exposure activates the sympathetic nervous system, but it doesn't cause sustained cortisol elevation. In fact, cortisol drops below baseline 1 to 3 hours after the cold exposure. The stress response is real, but it's brief, and it resolves into adaptation. So that's the foundation of this video. Now let's look exactly what adaptation can produce. Finding 1, the neurochemical effect. This is the one that gets people hooked, and for good reason. When you enter cold water, your body releases a surge of catecholamines. Those are your fight or flight neurotransmitters, norepinephrine, dopamine, and the numbers here aren't exactly subtle. A research team at Charles University in Prague measured what happens during a 1-hour immersion at 14 degrees Celsius. What they found was wild. Norepinephrine increased by a massive 530%, and dopamine increased by 250%. Those are enormous shifts, comparable to pharmaceutical interventions. And crucially, these elevations are sustained. They remained elevated for hours after you get out of the cold. Unlike caffeine, where you spike then crash, cold therapy acts as a long-lasting neurochemical shift that persists well beyond the exposure itself. Now, what did these neurotransmitters actually do? Well, norepinephrine drives alertness, attention, and arousal. It enhances blood circulation and ensures efficient oxygen and nutrient delivery, as well as simultaneously heightening cognitive focus. Dopamine is about wanting, not about liking. It's why most people report feeling driven and focused after the cold exposure. It's not quite the same as euphoria in that regard. There's also a third neurochemical component that's worth mentioning. Cold exposure triggers the release of beta endorphins, your body's natural painkillers and mood enhancers. During the initial shock of immersion, these endorphins are released to counteract the acute stress and discomfort. The interplay between norepinephrine driving alertness and endorphins soothing pain creates that paradoxical combination of heightened mental clarity alongside a surprising calm that regular cold plunges describe. A 2022 study put this to the test by measuring subjective outcomes after combined cold exposure and breathing exercises. Participants reported decreased tension, decreased anxiety, decreased fatigue, and increased vigor. This aligns perfectly with the neurochemical signals we're seeing. And here's something completely counterintuitive. Your cortisol does spike during cold exposure. That's because of the acute stress response. But 1 to 3 hours later, it drops below baseline. And with repeated exposure over weeks, the cortisol response diminishes while the other neurotransmitters stay the same. This is called cross-stressor adaptation. In simple terms, you're training your stress response to be more efficient. Less panic, same benefits. And this adaptation appears to generalize. People who regularly do cold exposure report improved stress tolerances in other areas of their lives. That's a really useful adaptation to counteract the effects of modern life. Alright, the second finding is all about metabolism, and this is where things get really interested. Most of the fat on your body is white fat. White fat stores energy. It's the fat you think of when you think about body fat in general. But you also have brown adipose tissue, or BAT. Brown fat does the opposite. It burns energy. It generates heat instead of storing calories. Brown fat contains something called UCP1 uncoupling protein 1. This protein sits on the inner mitochondrial membrane and allows your mitochondria to produce heat instead of producing ATP, which is what it normally does. And cold exposure is the most potent activator of this switch. Recently, researchers identified the exact molecular mechanism connecting your nervous system to brown fat activation. A protein called AIDA, sitting on the outer mitochondrial membrane. This gets activated by norepinephrine signaling during cold exposure. It then moves into the inner membrane and directly switches on the UCP1. When researchers genetically removed AIDA in mice, the animal couldn't thermoregulate in the cold and they became hypothermic. That's how important this central pathway is. But here's where it gets fascinating. A 2021 study revealed that this isn't just a local fat response. It's a coordinated whole body metabolic shift. When you experience cold, your liver ramps up glucose production from non-carbohydrate sources, your white fat releases fatty acids, and your brown fat switches from burning fatty acids to burning glucose. This is called the liver BAT axis, and it represents a genuinely sophisticated metabolic response across multiple organ systems. And cold exposure doesn't just activate the brown fat cells you already have, it can actually convert white fat into brown fat-like cells called beige adipocytes. These beige cells develop multiple small lipid droplets, acquire more mitochondria, and start expressing UCP1, making them metabolically active instead of just sitting there storing energy. And remarkably, this process is reversible. When the cold stimulus is removed, the beige cells convert back to white cells. It's super flexible. That is an absolutely extraordinary example of plasticity. Now here's why all of this matters practically. A landmark study published in Nature Medicine examined 10 days of cold acclimation therapy in patients with established type 2 diabetes. Participants wore light clothing in a room maintained at 14 to 15 degrees Celsius for 6 hours daily. Despite the modest intervention duration, insulin sensitivity improved by 43%, measured using the gold standard clamp methodology. Brown fat activity increased by 57%, and they also saw reduced fasting glucose, triglycerides down 32%, free fatty acids reduced by 11%, and blood pressure reduced by 10 over 7 millimeters of mercury. Those are substantial metabolic improvements from a non-pharmacological intervention. The protocol was pretty intensive. 6 hours daily is a lot of cold exposure, but it demonstrates the upper bound of what's possible with this treatment. And even shorter protocols activated the same pathway. It's the dose-response relationship that matters. Here's a question for you. Can you voluntarily influence your immune system? For most of medical history, the answer was thought to be no. Then a team at Radboud University Medical Center designed a remarkable experiment. They took individuals trained in the Wim Hof method, a combination of specific breathing exercises, meditation, and progressive cold exposure, and injected them with an endotoxin. That's a bacterial component called the lipopolysaccharide that triggers a controlled inflammatory response. Normally, this causes flu-like symptoms: fever, headache, nausea, and body aches. It's a well-established immune challenge model used in clinical research. But the trained response had a completely different reaction to this stimulus. Their anti-inflammatory marker, IL-10, increased rapidly and reached higher levels than the controls. Additionally, the pro-inflammatory markers, so things like TNF-alpha, IL-6, IL-8, decreased by about 50%, and their flu-like symptoms were significantly reduced. They had learned to modulate their own immune response. That's a remarkable finding, and a 2022 study helped explain this mechanism. The combination of breathing exercises and cold exposure triggers an epinephrine surge, and this epinephrine modulates the monocytes. These are immune cells that produce different inflammatory cytokines. The result increased the IL-10 production and dampened the inflammatory response. Critically, this operates through sympathetic nervous system stimulation and not through cortisol-mediated pathways in the hypothalamic pituitary axis. But there is a subtlety, and it's important. A 2024 systematic review looked at inflammatory markers across multiple time points, and they found a biphasic pattern. Acutely and immediately, 1 hour after immersion, inflammation actually goes up, which to me seems pretty appropriate given the stimulus. Your body is responding to a genuine stressor. But at 12 hours, stress markers come down significantly. And in adapted individuals like regular winter swimmers who do 2 to 3 sessions weekly in near freezing water, you see lower baseline inflammatory markers overall, lower IL-6, TNF-alpha, and higher IL-10. This is observational data, so it has to be taken with a pinch of salt, but it does align with the mechanistic evidence. Okay, let's go one level deeper. What's happening at the cellular level? Because this is where the longevity implications become more and more compelling. PGC1 alpha is the master regulator of mitochondrial biogenesis. In simple terms, it's a signal that tells your cells to build more mitochondria, more of these energy-producing engines. It's important to know that mitochondrial decline is one of the hallmarks of aging. Anything that preserves or enhances mitochondrial function is worth paying attention to. A 2020 study found that cold exposure combined with exercise produces greater PGC1 alpha upregulation than exercise alone. Specifically, cold triggers a truncated isoform called NT-PGC1 alpha that's particularly effective at driving fatty acid oxidation and metabolic adaptation. Your cells are getting a stronger signal to build more energy capacity than they would do for exercise alone. But there's even evidence that suggests that cold affects autophagy, which is your cellular recycling system. Think of autophagy as your tissues clearing out damaged components and replacing them with fresh ones. It's one of the key processes that keeps your organs and body systems functioning well as you age. Brief cold initially impairs this process. That's the acute stress again, but repeated cold exposure enhances it. You can see the common theme. Challenge leads to improved capacity. And here's an important practical detail. Shivering inducing cold engages these pathways more effectively than brief non-shivering exposure. Brief low-intensity cold plunges that don't trigger shivering produce the catechistamine effects, the mood and focus benefits, but may not fully engage the mitochondrial biogenesis and autophagy pathways. If you're specifically after these deeper cellular adaptations, you need a sufficient duration and an intensity to create genuine shivering response and metabolic challenge. Finally, cold exposure increases heat shock protein expression. Despite the name, heat shock proteins aren't just about heat. They're about a concept called proteostasis, which is maintaining protein quality control inside your cells. They respond to any cellular stress by helping proteins fold correctly and clearing out the damaged ones. Training your resilience to cold improves your resilience to other stresses at a fundamental cellular level. The same molecular machinery that helps you tolerate the cold helps you handle other forms of stress more efficiently. Now, there's one area where timing really matters, and if you're strength training, this is worth understanding so you can get the most out of both. If you're trying to build muscle, you'll want to avoid cold exposure immediately after resistance training because the evidence shows it can blunt your hypertrophy response. A 12-week study compared two groups doing the same resistance training program, one doing cold water immersion after every session and one just doing active recovery. Cold water immersion suppresses satellite cell proliferation, and these are the stem cells that repair and grow muscle after you've damaged them through training. It also blunts a pathway called mTOR signaling, and this is responsible for driving muscle protein synthesis. In simple terms, the inflammation and mechanical stress from resistance training is part of the adaptation signal. It's how your body knows how to build more muscle. Cold suppresses that signal before your body can use it. Now, cold water immersion does reduce perceived muscle soreness. You really do feel less sore, which is useful if you're training a lot. But for maximizing muscle growth specifically, you want that inflammatory signaling window to do its job first. The good news is it's a really simple fix. Either delay cold exposure 4 to 6 hours after resistance training to give that hypertrophy signal cascade time to kick in, or do cold exposure on separate days from lifting. For endurance athletes, this isn't a concern at all. Immediate post-exercise cold water immersion is absolutely fine and can actually enhance the adaptations you're after. Endurance training relies on mitochondrial biogenesis and metabolic efficiency, which, as we've discussed, cold water supports. It's only the mTOR-driven protein synthesis pathway in strength training that benefits from being left undisturbed. Once you know how to work the timings, you can have your cake and eat it. Alright, here's what all this means in practice. Based on the research, here's what appears to be the minimum effective dose of cold exposure therapy. For total weekly time, I would consider around 11 minutes per week of deliberate cold exposure spread across 2 to 4 sessions of 1 to 5 minutes each. This comes from the work of Susanne Somberg and colleagues at the University of Copenhagen, and it's the most frequently cited practical recommendation in the literature. For temperature, I would consider the therapeutic range between 10 and 15 degrees Celsius for water, so that's 50 to 59 degrees Fahrenheit. If you're a beginner, start at the warmer end, so the 12 to 15 degrees for 2 to 3 minutes, and work down gradually over weeks as your body becomes more used to the exposure. Advanced practitioners can work at about 8 to 12 degrees for 3 to 6 minutes if they can control their breathing throughout. The key principle is that the water should feel uncomfortable but manageable. You should not be in a dangerous situation. A quick note on a popular topic I get asked about a lot: cryotherapy chambers versus ice bath. Water transfers heat 25 times faster than air. Even though the air temperature in whole body cryotherapy is much colder, sort of looking at minus 110 to minus 140 degrees Celsius, the thermal load on your body is actually comparable to cold water immersion at 10 to 15 degrees Celsius. Both activate the sympathetic nervous system, both trigger norepinephrine release, and both activate brown fat. If you've got access to a cryotherapy chamber, it's an option that might make it more feasible to fit this habit into your daily routine. The shivering threshold matters. If you're primarily after mood and focus benefits, brief, non-shivering exposures are sufficient. But if you want that deeper cellular adaptation, the mitochondrial biogenesis, the enhanced autophagy, you need exposures long or intensive enough to trigger shivering. This is where the metabolic demands engages those deeper pathways. For timing, morning is ideal if you want to maximize that alertness and focus boost. The norepinephrine effect is perfect for starting the day. If you're combining cold exposure with a sauna, end on the cold rather than heat for maximum brown fat activation. Again, that reference Soberg's research. And if you're strength training, keep your cold exposure separated by at least 4 to 6 hours or on different days completely. Now, safety. This is important. Water below 15 degrees Celsius can trigger cold shock and drowning. This is a real risk. The cold shock response produces involuntary gasping, and if your face is submerged, this can be fatal within seconds. Never ever do cold exposure alone. Gradual acclimatization is essential. Keep your head above the water, especially when you're just starting out. You need to watch for uncontrolled shivering, numbness, dizziness, or chest tightness, and if you experience any of these, get out of the water immediately and seek help. Plus, if you have cardiovascular disease, uncontrolled hypertension, Raynaud's syndrome, cold urticaria, or peripheral vascular disease or neuropathy, please consult a doctor before starting any cold exposure protocol. Cold increases cardiac workload, and for people with existing cardiovascular vulnerability, the acute strain of cold immersion can actually trigger ischemia or arrhythmia. So, there you have it, the current state of evidence on cold exposure. It is a legitimate hormetic stressor with documented benefits for metabolism, mood, immune function, and cellular adaptation. Now, if you're interested and you want to see where cold exposure fits into the bigger picture, I've made a video on ranking longevity interventions by evidence strength, and I'll link it somewhere up here. As always, I've compiled all the research included to make this video into a citation library, and I'll link it in the description below. It's free. Go and check out the research yourself. If you found this useful, subscribing helps it reach more people. Let me know in the comments if you've got any questions or if there's topics you want me to cover. Until next time, look after yourselves.